everyone, and welcome to today's webinar, Calming Your Nerves, Naturopathic Approaches to Anxiety and Stress Management. We are grateful you have taken time to join us. My name is Alexandra Sislowski, and I'll be your moderator. I've been a member of Pascoe Canada's sales department for over 2 years, and I'm very excited to be hosting today's webinar. Pascoe Canada is the Canadian subsidiary of Pascoe, headquartered in Gießen, Germany, which is a third-generation family-run manufacturer of natural healthcare products. Pascoe Canada is dedicated to bringing our consumers, retail partners, and medical community premium natural healthcare products with over 125 years of history. Our products are made in Germany and are carefully harvested by hand from locally sourced natural ingredients. We only use high-quality raw materials, and when possible, the medicinal plants are cultivated under organic conditions. Pascoe's portfolio in Canada includes over 70 products that are herbal, homeopathic, and dietary supplements. Today's webinar is on the Calming Your Nerves, Naturopathic Approaches to Anxiety and Stress Management, presented by Dr. Melissa Descoteaux. We are thrilled to have you join us, Dr. Melissa, and share your expertise on the subject matter. Without further delay, I'd like to welcome our presenter, Dr. Melissa, and turn the time over to you.
Thanks, Alex. Okay. So as Alex said, I am a naturopathic doctor. I just want to talk a little bit about my practice. I am in downtown Toronto and in Oakville, doing virtual visits for the last few months, but then as of this week, now seeing patients in person, which is great. And I am very passionate about empowering my patients to take control of their health. In practice, I like to help patients optimize energy, digestion, sleep, and stress management, and also mood. So that's why I'm very excited to be here today to speak with you about this topic. I like to bring wellness back to basics, focusing on daily things people can do throughout the day, and tailoring the treatment plans so that they're achievable and effective. And I like to base my practice very much so on evidence-based treatments. As a naturopathic doctor, we are trained in so many different modalities, and it's nice because you can say kind of our toolbox, if you will, is very large and we can pull a lot of things. So in practice, I like to focus on clinical nutrition. So I really believe that nutrient-dense foods is one of the most important tools to help your body maintain health and prevent illness. And diet is very individualized, so I like to make recommendations specific to certain health conditions and to that person. I use supplements, so that's natural health products. That include kind of vitamins and minerals at therapeutic doses. Herbal medicine, so also known as botanical medicine, which utilizes plants and herbs in different forms, such as teas, tinctures, tablets, for a variety of health conditions. Lifestyle counseling, which helps patients make those changes with their diet or taking those supplements regularly. Traditional Chinese medicine acupuncture, and I have virtual acupuncture here because that's what I was doing for the last 3 months, but now I am doing it in person, so traditional needle acupuncture. Diagnostic testing, specialty testing like food sensitivity testing and hormone panels I use often in practice. And I did additional training and certification in IV and injection nutrient therapy, which I am practicing as of this week because you need to be in person for those visits. So today, I want to talk to you about the connection between anxiety and stress and a little bit of how they differ, looking into, is it anxiety or something else? So how to rule out underlying conditions that may worsen anxiety symptoms or even cause anxiety symptoms. Diet and lifestyle interventions, so how to naturally kind of calm yourself and ease anxiety. And then I'll touch upon some natural health products and herbal medicines for anxiety and help your body cope with stress. So kind of what is anxiety? So I found this picture, and I think it really depicts kind of anxiety and how it might feel for some people. And anxiety can kind of have a mind of its own. So this conversation might happen for yourself, but anxiety is kind of yelling, it's too much. You're saying, what is too much? Anxiety is kind of still yelling, everything is too much. And you can feel like, I'm sitting at home on the couch, I'm not doing anything, but yet you still feel incredibly overwhelmed. So anxiety is the body's natural response to stress. And it kind of encompasses feelings of fear, being scared of something that's to come or not to come. So the unknown can create feelings of anxiety and unease. So in short, anxiety is a feeling composed of different emotions and physical symptoms that are related to worry and fear. So as a medical, in kind of a medical way, in medical diagnosis, there are many different types of anxiety disorders: PTSD, social anxiety disorder, OCD, panic disorders. But for the purpose of today's lecture, I want to kind of go over generalized anxiety disorder, where the trigger is kind of unknown and it's just a general feeling of unease. So there's different criteria and specific criteria for this condition if you were ever diagnosed with an anxiety disorder. So that would be excessive anxiety and worry on most days for more than 6 months. The worry is very hard to control. And then the worry is also associated with 3 or more of these following symptoms. And again, this would be on most days for more than 6 months. So restlessness, feeling on edge, fatigue, difficulty concentrating or just having your mind go blank, irritability, physical muscle tension, sleep issues, so trouble falling asleep, staying asleep, having a restless sleep, feeling unrefreshed when you wake up. In other articles, they also add symptoms like chronic headache, digestive symptoms can be associated with it. And the biggest thing to note is that this worry causes impairment in your social interactions, your personal life, your work life. And even though it can be triggered by something happening in your life, the worry tends to kind of shift from one concern to another, and you don't really feel like you can control it. An anxiety disorder can start in childhood, adolescent, adulthood. In twin studies, they've shown that there is a genetic component and an environmental component that can kind of cause the development of it. There can be a gradual onset, or it can be kind of triggered by a stressful event in your life. So out of nowhere, you just feel anxiety. So we're going to do a poll related to this. So we'll give you a few moments just to kind of go over, answer this question. Are you feeling more or less anxious since social distancing started? So this would be around mid-March until now. Okay, I think that's enough time to answer this question. So we'll go to the next slide. Okay, so 43% are feeling more anxious, 7% are feeling less, which is nice. Maybe being at home is more relaxing and less commuting. And then the same. So we're feeling already anxious before, and it hasn't really changed in the last couple months. Okay, that's interesting. So I wanted to ask this question because the difference kind of between, generalized anxiety disorder and just feeling anxious, there is a difference, and generalized anxiety disorder is a little bit more kind of extreme, but I wanted to kind of go over the numbers and show the difference. So the prevalence, so that's how often it would happen in a year of an actual anxiety disorder, is around 2 to 3% for the general population. And in a lifetime, the general population, around 5% of people will have been diagnosed with a generalized anxiety disorder. So just giving comparison, during this last pandemic, the Mental Health Research of Canada sent out a survey to 2,000 Canadians 18 years and older. And they did it in the last week of April. So we'd already been in the social distancing and in the pandemic for about 5 weeks. And it was all through Canada. And what they found was that levels of anxiety have quadrupled since the pandemic started. So 43%, which is almost equivalent to the answers in the poll, of adults between the age of 18 and 34 felt increased levels of anxiety. 27% of adults over the age of 55. And then women, almost half, 40% of women felt increased levels of anxiety. And then especially people with children at home felt increased levels of anxiety. And what was really interesting in this poll, in this survey that they sent out, was that with increased levels of anxiety, they also noted that there's less people accessing support for mental health during this time, whether because they don't know where to find the resources, but there's people who are feeling more anxious and not getting help for it. So that was kind of going over anxiety, and I would like to kind of go over stress separately, and then we'll kind of combine them. So what is stress? I feel for most people, when they think of stress, they think of emotional tension, physical strain, feeling overwhelmed. So stress, again, it's our body's natural reaction to a perceived threat or anything that your body needs to kind of respond. So for example, you're hiking through the woods and you see a bear. Your stress response system is going to be triggered and to either fight that bear or run away. So the fight or flight system. So I kind of want to go through that system and what's happening in your body when you get triggered by stress. So you have number one, a perceived stress. So this is usually people think of, oh yeah, stress, mental, emotional stress, work stress, stress at home, a deadline, but there's also physical stress. So an illness, an injury, fasting, these are all physical stresses on your body that also elicit a stress response. So you perceive a threat and then your stress response system is triggered. It's called the fight or flight system. It's also called the HPA axis, and I'm going to go over why it's called that. So you feel the perceived stress, and then in your brain, corticotropin releasing factor, CRF, it's a hormone. It's released from the hypothalamus in your brain. This goes and triggers your posterior pituitary gland, which is also in your brain, and it releases adrenochromatoin hormone, ACTH. This hormone, ACTH, then goes to your adrenal glands, which are on top of your kidneys, which are on kind of your mid to low back, and they release cortisol, which is known as the stress hormone. So once cortisol is released, it then affects multiple systems in your body. So it kind of slows down digestion, increases blood pressure, increases energy output, kind of suppresses wound healing, suppresses immune function, because the purpose is that it's shunting all reserves in your body to your muscles and to your brain so that you can either run away or fight and kind of shutting down everything else. So normally when cortisol spikes in your body, this triggers your brain to stop making those other hormones. So it's kind of shutting off the production of cortisol. So it's a negative feedback loop. So that's how your body kind of calms back down after being stressed. So this is naturally built in. The issue is when you are under long-term stress. So when cortisol is elevated for a long time, it can actually start to damage certain body tissues and hinder thyroid function, compromise immune function. It reduces the body's ability to heal. And there's three kind of stages of chronic stress. So the number one is the alarm, the fight or flight, so the trigger stage, which can actually be beneficial if used properly and if you're able to actually come out of it after and kind of calm down. The second stage is resistant. So this is when cortisol is elevated for a long time. For everyone, this is different. It could be weeks, it could be months that you're feeling under stress. You start to feel stimulated. This is when people might turn to things to cope with stress, not always healthy, alcohol or maybe smoking. You get more irritable, sleep issues. And then the third stage of chronic stress, which is kind of termed burnout, where you just feel extreme fatigue. So the burnout stage, also termed adrenal deficiency or adrenal fatigue, is really just kind of a combination of symptoms. It's not really a medical diagnosis, but it's kind of symptoms that happen from long-term stress. So it's kind of your body's tissues aren't responding to cortisol anymore. So you're not getting that surge in energy that you normally did from that initial fight or flight reaction. So you start to have low blood pressure, hypotension, you can feel dizzy, you can start to feel pain, low blood sugar. Inability to exercise is kind of a clue I see in practice with some patients. So normally exercise will give you a boost in energy no matter how tired you are. But when you're in this stage, any amount of exercise makes them feel more tired and just drained for multiple days after. You can also have mood changes. So chronic stress can lead to feelings of anxiety and depression. So this leads us to our next poll. So how does stress manifest itself for you? There's so many types of symptoms. So select one of the following. This is just limited to a few, but worry, muscle tension, in your neck and your head, racing mind. So you have racing thoughts. You gotta go to bed at night and your mind is just racing and you can't sleep. Insomnia, which leads to that, or other. So it could be anything else. It could be difficulty concentrating, lack of appetite, increased appetite. Okay, I think that's enough time. Let's see what the results say. Okay, so, more than half are feeling worry, muscle tension, that's very common, mind racing, also related to worry, and affecting people's sleep a lot. Okay, and then other. So there's other things that are happening too when you're under stress. Interesting. Okay, so we'll go to the next slide. So putting it together. So those symptoms you feel related to stress are also kind of symptoms related to anxiety. So they're very much tied together. I kind of want to go over a few things to kind of differ them, and this will help with management. So how to kind of cope with it, knowing is it more stress or is it anxiety or is it both? So when it comes to the kind of the description, as I said, stress is more tension, feeling overwhelmed. Anxiety is more kind of fear, apprehension, and worry. The trigger, so with stress, it tends to be more of an external cause, a deadline, a pandemic, and then it's alleviated when the situation is resolved. Anxiety can be more internal, so even though it's triggered by something happening outside or an event, more mind racing, more internal mentally, and then the worry continues. So even though the situation resolves, the worry will then shift to something else. So you're still worrying just about something different. The physical response can be very similar between both, whereas anxiety sometimes can be tied more to panic attacks, more kind of nausea, dizziness, chest pain for some individuals. And then the management. So with stress, it's really, a lot of it is relaxation techniques, knowing how to cope with stress, addressing the cause. And then with anxiety, those are also very helpful. And then also counseling, and in some cases, prescription medication can be beneficial for anxiety. So as you can see, they're very similar. They can overlap. But the big takeaway is, chronic stress can lead to feelings of anxiety, and anxiety, when dealt with chronically, can lead to a dysregulation in the stress response system, also leading to chronic stress. So they're very much tied together. So now that we've kind of gone over anxiety and stress, differences and similarities, what if it's not anxiety? What if it's something else? One criteria for the diagnosis of generalized anxiety disorder is actually it can't be related to a medical condition. So it's important to rule out underlying conditions that may worsen anxiety or actually cause feelings of anxiety and addressing and treating those medical conditions. So to rule out underlying causes, there's other things that you need to look at. So certain deficiencies, for example, iron, if you're anemic, can cause feelings of anxiety. Deficiency in magnesium, vitamin B12, hormonal imbalances. So specifically kind of related to thyroid hormones. So your thyroid is a gland in your neck. Think of it as kind of the thermostat for your body. And when it's kind of turned up, the thermostat is turned up, hyperthyroidism and you have too much thyroid hormone can cause feelings of anxiety. And they did a study in JAMA in 2018, 30% of those with anxiety were diagnosed with autoimmune thyroiditis. So treating that condition may help with their anxiety symptoms. Certain cardiovascular health conditions, arrhythmias, can kind of be interpreted as anxiety, but it's something happening cardiovascularly. Neurological conditions, certain food sensitivities. So are you eating something in your diet, artificial sweeteners, erythritol, aspartame, stevia, for some people can be very stimulating. And with the ketogenic diet so popular, a lot of people are eating products with those things in it. Certain medications, so levothyroxine, which is thyroid hormone that people take when they have an under-functioning thyroid. If the dose is not appropriate or for some reason your body needs less of it and you're still taking the same amount, can cause symptoms of anxiety. Desiccated thyroid, which is another version of thyroid hormone. Albuterol, which is a puffer for asthma, can cause feelings of anxiety. Decongestants, it's allergy season. So Sudafed, which contains pseudoephedrine, can definitely cause feelings of anxiety. So these are things it's important to kind of look over every part of your life and see what could be causing it outside of just mental and emotional stresses. So ways to rule it out, seeing a naturopathic doctor or a medical doctor to do blood work. We can do all this blood work. So a complete blood count, so looking for anemia, checking iron levels through ferritin, a complete thyroid panel, measuring all the hormones. Blood sugar is really important. We're going to talk more about that. Looking at red blood cell magnesium can be more accurate than looking at serum magnesium. Vitamin B12 levels, and then specialty testing like food sensitivity testing can be nice to check if we're kind of optimizing the diet for the patient. So now I want to talk about kind of diet and lifestyle things we can do to help calm yourself naturally. But first, we'll go to our last poll question. So how do you cope with stress? Before I kind of dive into the things I would recommend or things that are beneficial. So select one of the following: exercise and yoga, meditation, sleep, or you don't cope with it well, or you don't. There's many more than this. So if you don't do any of these three, but you do something else, that's okay too. Okay, so let's take a look at the responses. Good. So a lot of people are doing exercise and yoga. Meditation is great. Sleep, great. Even though it's affected by stress and anxiety, more of it is good. And I don't. Okay, so let's go over, hopefully this will have some helpful tips that we can try. So we'll go to the next slide. So first I'd like to talk about diet, and then we'll talk about lifestyle. So when it comes to diet, one of the really important macronutrients, a lot of people think of carbs because they're very comforting and a lot of comfort foods have carbs in them, but protein is super important for managing anxiety and mood. So you want to be getting 1 gram of protein per kilogram body weight. So it really depends on your size for how much protein you should be getting. That's a general guideline, changes on how much exercise you're doing and types of exercise, but from animal sources or plant sources. The reason is protein is a building block for neurotransmitters that help regulate mood, specifically kind of serotonin, which helps regulate anxiety, emotions such as happiness. And as you can see, you require protein to create serotonin, as well as nutrients like iron, magnesium, B vitamins, zinc. So, it's multiple things that help with the production of these neurotransmitters. And one thing that's really important to note is that the majority of it is actually made in your gut. So that's why they kind of call your stomach and digestive system the second brain, or they refer to the gut-brain axis for mood. So not only is it important to get enough protein in your diet, but it's important to check in with the state of your digestive system. So if you're always feeling bloated, constipated, have frequent diarrhea, these things should be addressed to make sure that you're actually absorbing the great diet that you might be eating. So another important aspect when it comes to diet is maintaining a balanced blood sugar. So I found this diagram in an article in Psychology Today on stabilizing your mood with blood sugar regulation. So on time zero, so like on the far left line is when you eat your sugary meal. And then the red line is your blood sugar. So about 30 minutes after, your blood sugar will spike because you ate something very sugary. And then about, an hour and a half after your meal, your blood sugar will drop down. And when your blood sugar drops, you can kind of think of it as your body's energy source. The sugar is gone. So then it gives your body a shot of adrenaline, cortisol. And these hormones, the stress hormones, can cause you to feel panicky, anxious, weak, sweating. So it's really important to balance your blood sugar throughout the day to prevent these drops in blood sugar. So ways you can do that with diet is, number one, low sugar diet. And then I say low sugar diet, but this should kind of just be a general kind of healthy diet guideline, trying to limit refined sugars as much as you can, even natural sugars. So you don't want to just be eating honey and maple syrup all day long, even though they have many beneficial aspects to them. And less than 30 grams a day of refined sugar should be the goal. Majority of people are eating around, 80 to 90 grams of sugar a day. It's very easy for it to add up. In a study in the American Journal of Clinical Nutrition in 2015, they actually found an association between high glycemic diets and anxiety rates. So high glycemic foods are foods that spike your blood sugar really quickly and then they drop really quickly. Another way too is to focus more on complex carbs. So that's kind of whole grains, starchy vegetables, things that take longer for your body to break down so that it doesn't spike your blood sugar so quickly. So focusing on maybe 3 to 5 servings a day. This varies from person to person. And 1 serving equals half a cup cooked. So overall, you want to really focus on, a whole food balanced diet, mostly plants, because mostly plants tends to be more anti-inflammatory, to make sure that you're getting all the micronutrients and macronutrients that you need to help stabilize your mood. And then if you're kind of that person that really likes to, well, what specific foods should I eat for anxiety and mood? You can kind of look at the micronutrients and which foods have more of those and focus on those types of foods. So zinc, cashews, liver, egg yolks, chickpeas, foods that are high in magnesium, leafy greens are great. Probiotic foods, just to kind of help balance your digestive system in general. And with fermented foods, because they provide beneficial bacteria for your gut flora. B vitamins, foods that are high in iron, plant-based or animal-based. One food in particular that you might notice pop up in multiple categories is pumpkin seeds. High in protein, high in zinc, magnesium. So that's a great food to have as a snack or to throw on salads. So I always usually recommend pumpkin seed. So for a lifestyle perspective, sometimes I feel like a broken record always talking about exercise, but it's very, very important. And there's a study that did show that as little as 3 times a week, getting your heart rate up for 20 minutes helped manage anxiety levels. And this is actually less than what the Canadian Food Guide recommends for weekly exercise, which is 150 minutes a week. So it's very doable. Yoga, which a lot of you are already doing, very great, and definitely has been shown to decrease anxiety levels in studies. One interesting one was aromatherapy, which, so just smelling essential oils. The one, there's multiple studies, but the one essential oil that was consistent was lavender oil. And they used it for medical patients who are undergoing procedures, so breast cancer patients undergoing biopsy, burn patients, and the patients reported reduced anxiety levels and reduced pain, which was interesting. And then focusing on sleep. Sleep is very important. So avoiding things that can kind of negatively affect your sleep. So avoiding caffeine and alcohol. And then it was interesting on the Mental Health Research Canada survey that they did back in April, they asked most of Canadians, or they asked a large portion of Canadians, what activities helped them stay calm. So playing with pets, talking with those outside your household. So maintaining social connections, even though we are physically isolated and distanced, we shouldn't be socially distanced. And then reading. So for everyone, it's different on kind of what helps calm them. Other lifestyle things are cognitive behavioral therapy. So this is personalized therapy that you would do with a therapist. You want to do it weekly for a minimum of 8 weeks up to 20 weeks. And the great thing is that this is first line treatment for any type of anxiety disorder. So it can definitely be beneficial for just feelings of anxiety. And the effects usually last longer than even when the therapy sessions stop. The effects last longer, which is that's not the way it is with medication. So it can be a nice alternative. Mindfulness-based stress reduction can be done with CBT or on its own. And what it is really, it's kind of the opposite of autopilot. So you're trying to witness, label emotions without reacting to them, learning how to sit with emotions and be in the moment. So this can be uncomfortable, but also very beneficial in helping manage stress and anxiety. Acupuncture, there's many studies on this in reducing feelings of anxiety and help lowering the stress response system. So traditional Chinese medicine acupuncture, doing it weekly or twice a week, and you would want to do it for 6 to 10 or even 12 weeks to feel the benefit of it. So in Chinese medicine acupuncture, points are done all over the body to help cope with stress based on meridian channels. Specifically, the ones in the ear, auricular acupuncture, can be very beneficial. And these points are actually used in protocols such as the Natter protocol for smoking cessation. And it helps people kind of, because when you're quitting smoking, sometimes you can feel agitated. So it helped them feel calmer and to have less cravings for cigarettes. So lastly, I just wanted to touch on a few supplements and herbal supplements for anxiety and stress. So B vitamins. Deficiencies in B vitamins have been associated with anxiety. So there was a study that showed even supplementing, even if not deficient, so B12 injections, even when serum levels of B12 in those individuals were normal, showed an improvement in unexplained anxiety. B6 shown to be beneficial when supplemented for anxiety and depression in women who were deficient. So things that can deplete B vitamins are birth control, hormones, alcohol, compromised digestive function. So these are things that sometimes can be beneficial. Magnesium. Magnesium is a mineral involved in more than 300 enzymatic reactions in your body. As we saw, it helps with production of serotonin. And in studies was shown to actually relieve anxiety in those who were using it, but for other conditions. So you're using it for cardiac conditions, but the patients reported feeling less anxious when they took magnesium. Omega-3s, interestingly, it's anti-inflammatory. So in a study, it actually did show the effects of being anti-inflammatory, and it reduced levels of anxiety. And in the study, it was a small study in 70 medical students who were young and healthy, and supplementing with omega-3 for 12 weeks, so it is a while, showed a benefit. And then supplementing with iron and vitamin D. So these are supplements you definitely want to check your serum levels. And if you're deficient, that's when you would supplement, and that's usually when you feel the most benefit from it. So speaking with a naturopathic doctor before just taking all of these is probably the best way. So for herbal medicine can be great to help the body cope with anxiety, specifically anxiolytic herbs. So anxiolytic meaning anti-anxiety or anxiety relieving herbs. So lavender, as I said previously, was used in studies as an aromatherapy, so just smelling it, but it was actually used orally also. So patients took it by mouth daily for 10 weeks versus an SSRI, paroxetine, which is used for anxiety as a prescription medication, and it was comparable with less side effects, which is good. And then passion flower, also known as Passiflora incarnata, there's a lot of really good quality studies on the benefit for sleep. There was one study used just as a tea for sleep, and then for generalized anxiety disorder versus a benzodiazepine, which is a medication for anxiety, showed beneficial with, again, less side effects as a prescription medication. The last one that I want to talk about is kava kava. So that herb can be beneficial short term for generalized anxiety, so for like 3 to 6 weeks. You do have to be cautious with the form, so you want it to be an aqueous form and not alcohol extract. There was some research on showing that it elevated liver enzymes when people took it, so liver damage. You really have to be careful with what form you're using, but multiple studies afterwards have shown no side effects, so, and just benefit for anxiety. So those are anxiolytic herbs, and then these herbs are used more for stress management. So they're called adaptogenic herbs. So in the graph, you can see it kind of helps your body cope with stress, so a less high of a stress response, even though you're still experiencing stress. So ashwagandha, which is an Ayurvedic herb, helps in studies with physical endurance, with preventing stress-induced illnesses. And then Siberian ginseng, which is different from Panax ginseng, which when people hear ginseng, they're usually thinking of Panax. This is Eleuthero ginseng. Improved physical and mental capacities under stress. And rhodiola, which is a really great herb. It's great for people who feel tired when they get stressed, so it's a little bit energizing. So it helps fatigue related to stress, and also with athletic performance. So the thing when it comes to stress, you can do a lot of diet and lifestyle. You can use herbal medicines to help cope with it. But one thing for stress specifically, how to make stress your friend. So this is a really great TED Talk. It's by Kelly McGonigal. It's from 2013, a little older, but if you have 15 minutes, she talks about all the research and the science behind how when people viewed stress in a positive light, they actually had less negative effects on their body. So making stress your friend can be an option also. And if you are feeling very overwhelmed, very anxious, or feeling very stressed or mental health, there's so many resources in Canada right now through your family doctor. If you don't have a family doctor, ontariohealth.ca to find a family doctor. Telehealth Ontario is great. You can talk to a registered nurse. Connects Ontario has live web chat and email. The federal government put in port a mental health portal. The Kids Helpline actually opened a line specifically for adults because they were getting overwhelmed with so many calls, not just with kids, but also adults with mental health issues. The Canadian Mental Health Association has good resources. And then Mind Your Mind is a really great website with many resources for Canada and US, hotlines, links on programs. So always reach out if you need help. So overall, when it comes to anxiety and stress management, you want to speak with someone, with a friend, a family member, maintaining social connections, a naturopathic doctor if you want to dig deeper, rule out underlying causes, balanced diet and natural health treatments as needed, therapies, CBT, mindfulness, acupuncture, and recharge. You know, you can do anything you put your mind to, but you can't do everything at once. So trying to focus on yourself, increasing exercise, aromatherapy, spend time with your family, go for walks, just do something you like, and don't forget to breathe.
Thank you so much, Dr. Melissa, for sharing your knowledge and expertise with us today. I hope you all found this presentation as educational and informative as I did. Before we start the live question and answer session, I would like to highlight 2 Pascoe products that help to support stress and a healthy, balanced mood. The first one here is Naturopath. Naturopath is made with a triple herb combination of naturally sourced medicinal ingredients, dry extract of passion flower, valerian root, and St. John's wort. Naturopath affects the GABA as well as serotonin neurotransmission to help promote a healthy and balanced mood. The synergy between passion flower and St. John's wort in Naturopath's balance allows for a high degree of efficacy with excellent tolerability. As a herbal product, Naturopath has no known side effects, no addiction potential, and no hangover effect. Naturopath is suitable for ages 6 years and older, and the full effect of taking Naturopath consistently can be expected after 4 to 6 weeks of treatment.